Hello, this is Joseph with Next Gen Manual Therapeutics. And today I just wanted to kind of talk about a little bit of breadth and depth within the cranial uh, world, if you want to say it that way, and kind of like which way a cranial therapist. I mean, do you focus on the bone, kind of like cranial osteopathy, um, or even SOT out of the chiropractic, the sacrooccipital technique, where they really look at the sutures a lot. Great stuff, especially when there's a sutural problem. Uh, do you look at the bone? Is there bone compression? So that's become more and more, I think, relevant. I mean, I think that some of the work on bone and our advancing knowledge of fascia and how bone is actually a type of connective tissue and how vascular the bone is, not just in the head, but certainly even the cranial bones are very vascular, from emissary veins so that there's really a lot of blood flow there. And so, or is it the meninges, right? I always thought that kind of upledger style was a lot of the meninges. He named his second book, I think, Beyond the Dura. And certainly there's a lot of work to be done with the dura and fluid flow. The original, some of Sutherland's people really talked so much about the fluid. The fluid. Now, there's the CSF, the cerebral spinal fluid, and that's a wonderful theory. I mean, they're still figuring out aspects of that. In fact, just in 2014, did they find the glymphatic system? So they named it, right? And interestingly enough, I had a teacher, Sharon Weiselfish Gimateo. That's a name for you, Sharon Weiselfish Gimateo. She's not with us anymore, but she talked about lymphatics in the head and brain really back 90s, 2000s. She wrote a couple of books. Integrative manual therapy for the upper and lower extremity, I think, was one book, and she did integrative manual therapy for, I believe it was autonomic nervous system. And in that book, she talks a little bit about draining, the cranium, draining the head, a lot of venous pressure, and also kind of implies the drainage of lymphatics from the cranium, which she did mention in her courses. I took courses with her back in the 90s and early 2000s. So that system, she called it at that time, was integrative manual therapy. That integrative was the big thing then, integrative medicine, integrative manual therapy. So she was integrating cranial, visceral, myofascial release, muscle energy technique, just a variety. It was really, I think, one of the leading edge practices, manual therapy practices of the time, really kind of picking up where osteopaths had left off in the, you could say 80s, right? The AMA took over in the late 60s. So, they still had the old osteopaths for another 20 years, right? Through the 90s, maybe, just to, generalize a bit. Also, with the cranial perspective, is it the brain, right? The Upledger wrote a book called The Brain is Born, right? It's mostly around the developing, kind of embryologic stages of neural development, but also working with the nervous system that you don't hear as much about in cranial training sometimes. And really, with the fluid flow, I want to visit that for a moment. What happens is that what people think they're feeling as fluid often becomes very energetic. And because of the subtlety of touch, differentiating the types of energy or fluid flow, or the person needs to have a pretty refined palpatory skill set to make these differentiations. What are they feeling What's expanding? What's contracting? What's restricted? What's impeded? And if you look at the biodynamic folks, really what they start to move towards with their landscapes, which I would think of as fields of consciousness, essentially, aka also known as chakras. They don't say it that way, but if you're familiar with these systems, it becomes rather apparent. The first level is like the heart chakra, and that's part of the therapist development. That's great stuff that they actually notice that the therapist has their own developmental cycle too. And to get to the second level, where's that? The throat, or, maybe a little higher up, maybe. And, then the four, whatever they call the third or the fourth level, I haven't looked at that material in a little while, but is, higher up. You're really looking at probably kind of an astral interface. And what they're really probably working with there, I would say it a little more authoritatively, but is really the constitutional energy, which you could call the Kundalini energy. So, in which is really the energy that maintains the physical body, right? And part of the disconnect between perception is the physical senses and the perceptual senses. Like Musashi said all those years ago, he said, sight is weak, perception is strong. Sight is weak, perception is strong. And so, feeling hairs under the pages of a telephone book, that's nice for your tactile, your mechanoreceptors. And I do the same thing. And in other words, I try to keep my tactile senses alive and well. The energetic perception is something different, right? People talk, and you're perceiving a different level. And that's what I think you see the biodynamic folks move into, while staying anchored in Sutherland's model, yet not really addressing some of the connections to really Eastern thinking. Well, don't we all have a body? Well, we do. But if they don't always mix in the same way. These concepts are referring to different things. In fact, that's another great point. I guess, I don't know if I was going to make a different video. I'm going to mention it now. I think that was a big thing with the early osteopaths. They were perceiving these things subjectively. And because it was so clear to them, in their training was good. They spent time with each other. They developed their skill sets. Their training was good. So they could perceive these things. They were taught how to do it. They could feel them so clearly that this is my take, is they presumed that science would find what they were feeling. And I think the disconnect is that really, science is more objective, and these people were having a subjective experience. Well, wait a minute, are you saying that's all make-believe? No, it's not make-believe. They're perceiving things that they're not really measuring, even as of yet. The glymphatic system's a great example. The glymphatic system is a great example. There's an article, maybe I'll post it. I know I saved it. It was written by an osteopath. He probably really wanted to be an MD, but he probably couldn't get into medical school. So he became a DO. I'm projecting a little bit, but the guy wrote an article, kind of a surly article, about we need to revamp the cranial model. We shouldn't be teaching this. This is a bunch of BS. Because this isn't the model. Now, the article was written, I want to say maybe 2011. I kept a copy. And the guy's points are well taken for the time. But then, 2-3 years later, they come up with the They discover the lymphatic system. So no, in one sense, that's not what he's talking about. And then it's absolutely what the cranial therapists, hands-on therapists are talking about. A fluid, cleaning the brain. Now we know just recently, by the way, if you're not aware, I'm sure you're probably aware of it if you're listening to something like this, that a few years back in China, they did this, they removed the lymph nodes and the cervical lymph nodes, and Alzheimer's patients improved dramatically in memory and executive function. What that tells us is that, the brain is cleaning itself. It's kind of a drastic way to go about it. Anyone who was in that boat, I think, would maybe elected, I don't know if these people elected to do it of their own their own volition. I don't know where they were at with that, but to have some more days of clarity and higher function. I say it that way because there's got to be a cost for that, right? You start removing lymph nodes, there's going to be increased toxicity and this kind of thing. Because those symptoms went away, we presume a lot, and maybe rightly so. But again, I think the cost, you can't, I don't think it's wise to just deny the cause and effect relationship of removing these structures. So that's kind of what I have for today, kind of just touching base, different elements of cranial therapy. Thanks for listening. You can see I have a Substack, under Somatician, and website NextGen Manual Therapeutics, or it's nextgenmt.net. Like to put some classes together for you guys. I'm going to keep doing that. There is a class up on nextgenmt.net on fascial fulcrums. It's really working with the interface. If you're interested in that, check it out. And we're going to get some more things up on biomechanics. And I'd like to do a hands-on skills set, a hands-on skills class, kind of like some of the things we're just talking about. Thanks so much for tuning in, and I'll see you next time. Take care. Bye-bye.